Good afternoon, my friend. Today we have the last, the second before the end, the lecture, and it will be about lymphatic system. Thank you. If you have a correct hearing and the sound is fine, everything. So, and the picture is also visible. So then we are going to start. Okay. Thank you. Everybody who come here. Nice. And today's topic is the lymphatic system. It will be very interesting history of the lymphatic system investigation in medicine, and lymphatic system is the system which help to drainage, to transport fluid from the tissue to the blood. And it is also a very important system because it helps to fight with the edema or with the a lot of when we get a lot of fluid in the tissue. And of course it is the first system which protect us from cancer and from the another foreign organism coming into the body, like microbes, viruses, etc. Let's see what is the lymphatic system made of, and we will take a look to the classification firstly, then classification of the lymphatic vessels firstly, then we will talk about function, development of this system, and we will discuss the structure and main group of lymph nodes. It is those are important part of the lymphatic systems. Okay, let's go. First of all, what is the lymphatic system? It is the integral part of the vascular system. As you see, lymphatic vessel, first of all, is a part of vascular systems, and it drains tissue with the help of lymph and transport lymph to the venous bed, to the venous vessel. As you see, they're all lymphatic vessels are. Анна Викторовна, спасибо, все пришли. Спасибо. Ну да, человек 8 есть, можно работать. Спасибо. Они записываются, я их прошу, они записываются все, но слушают. Ну, я запишу, сделаю фотографию вам, окей? Да, спасибо большое вам. Всего доброго, до свидания. And this is the green. Actually, they are not green. They are white and sometimes yellow, but not green. It is helpful to draw these vessels like green. And you see the yellow small parts. This is lymphatic nodes. So a combination nodes and lymphatic vessels. This is the real lymphatic systems. Don't be confused, because we taught another system which called lymphoid or immune system. Primarily, this system are organs, small and large organs, but that is not lymphatic system. It is something different, and I would like to, and I'm going to explain what the lymphatic system means. Another idea I'd like to share with you, it is the definition of the lymph. As you see, what does it mean, lymph? Lymph from Latin comes from the Latin language means pure water or moisture. It is a real liquid which fills the lymphatic vessels. It means that lymph is a fluid inside of lymphatic vessels. Usually, lymph contains special blood cells, white blood cells we call lymphocytes, and lymph is produced by the fluid filtration through the wall of the lymphatic capillary. Okay, so it is the first idea, and let me show you what is the real lymph is look like. Sometimes it is a transparent fluid, sometimes it is look like milk, and because it contains the fat, small fat parts, small fat elements, which give the lymph not make it not transparent. The lymph, the total, some of the properties or feature of the lymph. Total volume lymph in our body is from 1.5 to 2 liters. That is, its specific gravity is the same like in the blood, from 1 to 1.023 gram per cubical centimeters. The lymph has a moderately alkaline reaction. It means pH more alkaline than blood, from 7.4 to 9.2. Usually lymph consists of a liquid part and cells. And the cells we call T and B lymphocytes, special white blood cells. The liquid part contains albumins and globulins. That is a protein, like in the blood. Glucose and mineral elements or mineral salts diluted in the lymph. Regarding to the lymphocytes or lymph cells or lymphocytes, that is those are about 80% of so-called formed elements of the limbs, and of course the main part of the cells are lymphocytes, but remaining 20% are the share of other white blood cells like neutrophils, eosinophils, and others. You will talk about in the histological lessons in our department. Please take in your memory and remember that there are no normal erythrocytes or red blood cells in the lymph. Fluid part of lymph mixed with blood cells, and usually that is some of the mixed fluid. We distinguish three types of the lymph in the organism, in the human body. The first lymph, so-called peripheral lymph, is isolated, which has no passage from the lymph nodes. It means the peripheral limbs. This is the primary limbs which are produced in the tissue, which is come into the smallest lymphatic vessels called capillaries. Another lymph with the name central limbs is contained in the large lymphatic vessels like thoracic ducts, and sometimes in the lymphatic trunks, and that is those are real large lymphatic vessels with large diameters. And the third lymph, called intermediate or transient lymph, is one of the is a lymph which has passed through one or two lymph nodes. So three forms: peripheral, then intermediate, and then central lymph. Please take it in consideration. Let me explain what is the lymphatic system made of. It is a little bit confused, but I think you will get it easy. So lymphatic system is a part of the two systems, vascular systems and lymphoid system. As I told before, lymphoid or immune system, that is the complex organs, lymphoid organs, usually primary lymphoid organs like red marrow or thymus, and secondary lymphoid organs, spleen, pharyngeal ring, lymphoid nodules of the gastrointestinal tract, and the last group is the lymph nodes. So it is the first part of the lymphatic system, as you see here. And vascular system has blood vessels, those are arteries and veins. And the second group is the lymphatic vessels, and all of these lymphatic vessels is the second part of lymphatic systems. So as you can see here, lymphatic system means a prefabricated concept. It means it is a composition of the lymph nodes and lymphatic vessels. That's its combination. Okay. Here is the scheme or the components of lymphatic vessels, and first one group is the smallest lymphatic vessels called capillaries. Then the larger vessels called lymphatic vessels. Usually it will be seen or investigated without microscopic without microscope. And this is the second. Nodes are organs of lymphoid or immune systems, and they interrupt the vessels and divide them into bringing and taking out of lymph. In the nodes, as you see, we can find the lymph cells and some of the foreign agents like microbes, and it is also a lot of cells, lymphocytes inside of nodes. The fourth part of the lymphatic systems are again vessels, and that is a big vessels called lymph trunks, lymphatic trunks. It's better rather, and the largest vessels only we distinguish only two such large, real huge lymphatic vessels called lymphatic ducts. So between trunks and vessels we find organs. This is the parenchymal organs, lymphatic nodes, but other four parts are vessels. This picture show the differences and similarities between venosus and not inflammatory, is it between the lymphatic systems. And as you see, because they have similarity, we start from them. And first of all, the first similarity is the general scheme of development. As like in venosus system, you see here venosus or veins in the body, and here the lymphatic vessels. They come from the same origin in the embryonic period of the development of the body development. The outflow of fluid or direction when the blood come through the veins and come through the lymphatic vessels is the heart. All of this fluid come towards to the heart. It means heart direction. All ways come to Rome. It was the old Italian expression, and all fluid in the body come in the end to the heart. And valves, that is also the feature of the typical feature of the veins, and we can find valves inside of lymphatic vessels. What is the difference? First of all, lymph flows more slowly than blood, and because the pressure inside of lymphatic vessels is less than blood pressure in veins. And we will talk later about some criteria or about factors of lymphatic drainage, or factors which help lymph to transport lymph to the in the heart direction. The second difference is the lymph capillaries are blind. It means they have no connection between blood vessels. They start blindly, and usually the typical lymphatic capillaries has the same form, and lymph comes from the blind part here, from here to the another lymphatic vessels, and that is the typical for capillaries, lymphatic capillaries. and lymphatic vessels are interrupted by nodes. It means we have lymphatic vessels, and then it is the lymphatic nodes, and then lymph is filtered in the nodes and come to the another lymphatic vessels through the nodes. It means so there are three differences and three similarities as well. Here I'd like to demonstrate the wall structure of different vessels. A is artery, B, or Russian B, is vein, and Russian V is the lymphatic vessels. You see that all of vessels has three layers: inner layers, middle layers, and outer layers. We can find these layers in arteries, veins, and lymphatic vessels. And you see that valves on the internal wall of the veins, and almost the same structure, almost the same construction called valves we can find inside of lymphatic vessels on the inner layer of these anatomical structures. Another next slide demonstrates the function of the lymphatic systems. There are four of the main function. First is fluid recovery. Lymphatic vessels return lymph or fluid from tissue to veins, to blood vessels, and fluid continually filters from blood capillaries into the tissue, into the interstitial space. Then capillaries reabsorb about the capillaries, blood capillaries absorb about 85% of the interstitial fluid, but only 15% of the fluid are not absorbed by blood capillaries, and it is about from 2 to 4 liter of water which are left in the tissue, and these 15% of the from 2 to 4 liters in the all volume in the circulation, and this left fluid come into the lymphatic capillaries, not blood capillaries, but in the lymphatic capillaries. So rate between fluid coming into the blood capillaries and lymph capillaries is about 6 to 1. Anyway, this function taking fluid is very important, because even partial interference with lymphatic drainage can lead to severe lymphedema. Lymphedema, this is when fluid stay in the tissue and doesn't come to the veins. That is bad. Let I show you the result of such damaged lymphatic drainage of the tissue. Second function is transport of proteins and cellular elements. Usually lymph transports large molecules and some of the parts, cellular parts, which were destroyed in the tissue. Proteins come into the lymphatic vessels easy, but cellular element not such easy, and because they are large micro elements of inside of the capillaries. And important parts and important idea that lymphatic vessels can transport some cells, like here you see the cancer cells. Usually they are small in diameter, and they are able to come into the lymphatic vessels and transport by lymph. And this process, when tumor cells can be transported through the lymphatic vessels, is called metastasizing. It means that the tumor, especially cancer, come and start in other organs, and lymph usually if man or woman gets tumor in the intestinum crussum, and the small cells, with the help of the lymphatic vessels, transport to the liver, and the tumor starts to developed in the liver again, and this process called metastasis. This is a bad side of cancer, and usually doctors take in consideration that lymph vessels one is one of the way, in the main way for transporting of cancer cells. Then it is interesting function of the lymphatic systems is the transport of fats, usually from the small intestine and sometimes from the large intestine, because the fat is fluid which is not diluted in the water. It is we call it water resistant fluid, and usually it transported by the way of having small drops, small parts of the fat in the lymph, and this give the lymph white colors. It is interesting and it is visible when we see on the small intestine, and after people have some food, and we have this concise white fluid inside of lymphatic vessels during surgical operation, for example. And the also very important function of the lymphatic system, that is a defense and fighting with the cancer cells, like you see here. It is possible to see how lymphocytes attacking bacteria. This is a left picture. But lymphocytes, as a T killer lymphocytes, usually attack and kill cancer cells, and that is good because this is immune defense, help us don't get tumors during our long period of life. And that's why the immune correction and immune treatment will be the I think will be the good way to finish with come to the end with the cancer some in the future, I think. Okay, a couple of words about the history of the lymphatic system investigation. Actually, there are few areas in medicine whose history would be more interesting and fascinating than the history of the discovery of the lymphatic system. This system, lymphatic vessel system, was discovered in 17th century. However, in the medical literature of ancient times, like in ancient Greece, there were already fragmentary information. We can find fragmented information about the lymphatic system. For example, Hippocrates and Erasistratus spoke of white blood. It means lymph. And Aristotle, the teacher of Alexander Macedonsky, described formation containing a colorless liquid. It was, we understand that it was lymph also. The doctors of Alexandrian school described even the lymphatic ducts. But in the Middle Age, these information were completely forgotten. And the new life and new discovering of the lymphatic vessel were made by Italian physician Gaspar Azelli. You see his picture here, and we know, as far as I know, the Azelli was going to demonstrate at the request of his friends. He was going to demonstrate internal organ, and he undertook a vivisection. It means he prepared a dog and opened the abdominal cavity of this still lived dog. It is awful, of course, because we understand there were no anesthetic procedure, and he was going to demonstrate nerves and movement of diaphragm by breathing. Azelli opened the abdominal cavity and pushed back the stomach and intestines, and to his great surprise, he saw blood vessels branching in the mesentery filled with a white liquid. At first, he mistook these vessels for nerves. He thought it is not vessels, it was nerve. But as he wrote, amazed by the news of this case, I stood silent for a moment. It is the citation. And then I took a very sharp scalpel and made an incision in one of these white trunks, white structure. As soon as I touched it, I saw that a white liquid began to come out of the barrel, similar to milk or similar to sour cream. And that is the day of discovering of lymphatic vessels. Here you see the picture from Azelli's atlas, and here you see the small capillaries and vessels of the dog, I think so. Talking about history of lymphatic system investigation, I have to show you and call the name our academician Dmitry Arkadyevich Zhdanov. His picture you see here, and he founded Russian school of lymphology. By the way, Zhdanov was the head of our department. I mean, the department I am honored to be head also, and he was also the rector or director of our university from 1947 till 1956, about 9 years. Zhdanov brought up a brilliant galaxy of Russian anatomists and formed the Russian school of lymphatic system. And you can see the memorial plaque dedicated to academician Zhdanov in front of entrance to our department. It is the memory about this brilliant scientist. Okay, then our next task is information. I'd like to give you information about lymphatic vessels. And vasa lymphatica, this is a Latin term of the lymphatic vessels. You see here that 5 group of lymphatic vessels are vessels of various size. Smallest one are lymph capillaries, but the largest are lymphatic ducts. Let's take a look at each of these groups one by one. Here you see lymphatic capillaries. Lymphatic capillaries are the smallest, and by the diameter they are bigger or they are larger than blood capillaries in 2 at minimum, at least, up to 20 times. You see here the picture, and this is a combination of blood, capillaries, standard or typical, and green capillaries are lymphatic ones. And you see that the diameter of the lymphatic capillaries is bigger. Some organs have no lymphatic capillaries. They are absent in cartilage, usually articular cartilage, covering the surface, articular surface of the bones. We couldn't find lymphatic capillaries in placenta. This is a child place or organ in the body of the mother, which help and provide fetus with the nutritional substances and with the oxygen. There are no capillaries in the brain and spleen as well. The lymph capillaries are more permeable than blood capillaries and therefore can absorb large molecules such as a protein and lipids as well as the parts of the cells. Lymph capillaries are also slightly larger in diameter, as I told you before, and lymph capillaries have an unique structure that allows interstitial fluid to flow in these vessels, but not come out. What is the structure? The capillary wall, as you see here, is formed by a layer of endothelial These cells, these small cells, we call endothelial sites. And endothelial cells ends overlap, as you see. The one part of the small part of the one cells is overlap with another part of other cells, and between them we have opening, and this opening is quite large and maybe react to the content of the fluid inside of tissue. And when the pressure inside the lymphatic capillary is great, when there are a lot of fluid, volume fluid inside of capillary, it closed and no fluid come back to the tissue. But when we have a lot of fluid out of capillaries, it come inside through the opening. And another main elements of these constructions are anchor threads, like elastic fibers attached to the lymphatic capillaries. These small anchors or fibers help to fix parts of endothelial sites, and they make it open when the pressure in the tissue are bigger, or when we have increasing the tissue fluid pressure. Here, it is visible, these anchors when excess interstitial fluid builds up and causes tissue swelling when a lot of fluid are around the capillaries. The anchor cords tighten. They open the holes in the endothelial, between endothelial cells, and they manage to the entering fluid inside of lymphatic capillary. The absorption of colloidal solution of proteins increases with movement and massage. That is a medical procedure. I hope you know what I am talking about. Then lymphatic vessels. This is another second group of lymphatic vessels. Usually we can see lymphatic vessels without some imagination devices, without microscope. And how are lymphatic vessels different from capillaries? They have a thinner wall and have thicker wall. The wall of the lymphatic vessels are larger than wall of the lymphatic capillaries. And lymphatic vessels have valves, as you see here. This is a internal structure in the inner layer of the lymphatic vessels. Depending on the location, above or below the superficial fascia, the lymphatic vessels are divided into two groups: superficial group of the vessels and deep group of ones of the vessels. Superficial lymphatic vessels lie in the subcutaneous adipose, like you see here. This is the superficial lymphatic vessels, but of the deep vessels located under the deep fascia. Lymphatic vessels are formed from networks of lymphatic postcapillaries, and the transition of a lymphatic capillary to a lymphatic vessels is determined by a change in the structure of the wall. It means the capillaries have only one endothelium layer, but typical lymphatic vessels have three layers in the wall. Next picture shows the superficial here and deep lymphatic vessels. Depending on the localization, as I said, we distinguish superficial and deep. And usually the border between superficial is the proprial fascia covering muscles. So deep lymphatic vessels are located in the skeletal muscles, but superficial lymphatic vessels are right under the skin in the subcutaneous adipose tissue. Here you see idea and structure, functional unit or structural and functional unit of the lymphatic vessels. It is called lymphangion. I hope that is right pronunciation. Lymphangion. Lymphangion is the part of lymphatic vessel between two valves. It means here we see the the segment of lymphatic vessels between valves, and it is named lymphangion in our department. That is regarding to the work of the Zhdanov, Professor Nadezhdin, and Borisov, who worked in our department. It was a doctrine formed about lymphangion, and that is well known in different anatomical school in Russia and even abroad. So just remember that lymphatic vessels has different lymphangion, and lymphangion is the segment of the lymphatic vessel between valves, between its valves. Okay, let's go later, and let's go to the factors, flow factors of the lymph. And as I promised, I'd like to explain why does lymph flow through the vessels? Why lymph transport is transported through the lymphatic vessels? There are certain factors that contribute to the movement of lymph through these vessels. If these factors are violated, the fluid remains in the tissue. If this factor are violated or we have damage, then we see such strange extremities, lower extremities, left lower extremity, which in comparison with the right is bigger in diameter. That is the damage of the lymph flowing. The first factors of lymph flow is the pressure of the new formed lymph. It means the new lymph come into the capillaries and it push the old lymph in direction to the veins. Valves help for the flowing, because valves doesn't make possible with the retrograde or back flow of the lymph. Pulsation of artery pulsation is also help, because it is a new pressure and lymph vessels they accommodate arteries, and arteries help lymph flows through the lymphatic vessels. Another factors is made by skeletal muscles. They like a pump also contract the vessels and push lymph in one direction, in central direction to the heart. Respiratory execution and suction effect of venous blood, because veins are the container for lymph, which lymph come in the end, it comes to the veins, in the large veins. The negative pressure in veins during respiratory help lymphs to flow. Here another case of the damage lymphatic drainage, and we call such disease elephantias. It means elephant. This is a, you know what is a, this is a big animal with large ears, living in Africa and India. And elephantias is the problem which people have when the lymph drainage is damaged. The reason of lymphedema is that the lymph stay in tissue and formation there's such a big volume of. Usually we could find such problems in lower limb because it's difficult for the fluid come to the up direction. It is easy to come from upper part to the heart. Then it is in vertical position, especially in vertical position, that is difficult lymph come to the large veins. And what we call massage, maybe that's right pronunciation. That is a quite effective method of enhancing lymph flow from soft tissue. And I'm sure you know it is also very pleasant medical procedure, massage. Next, we see the lymphatic nodes. We will talk later about nodes, lymphatic nodes, but I'd like to show you that the lymphatic vessels are interrupted with the nodes, and usually this is the group of lymph nodes located in such body crossroad, like inguinal area, armpits, cubital area, knee region, back region of the knee, and in the abdominal and thoracic cavity, near the mesentery and near the mediastinum. So the third group of lymphatic vessels are called lymphatic trunks, and fifth group is lymphatic ducts. Usually they formed from lymphatic vessels, and they are no longer interrupted by lymph nodes. It means such as large vessels like trunks and ducts have no interruption with the lymphatic nodes. Here you see the scheme of lymphatic trunks. We have only two lymphatic ducts, thoracic ducts and right lymphatic ducts here. Very, very short one. But lymphatic trunks may be lumbar, paired trunks, unpaired intestinal trunk, and three trunks in the neck: jugular trunks, then subclavian trunks, and bronchomediastinal trunks. They come together and form on the right side right lymphatic duct, but from the left side they come into the thoracic ducts. And here here the list of all lymphatic trunks in our body: jugular, subclavian, bronchomediastinal, right and left lumbar, and unstable intestinal lymphatic trunks, which is formed from the lymphatic vessel of the mesenteric lymph nodes inside of abdominal cavity. Here also another scheme illustrated and colored. I think you will like it more. And here the 3 trunks in the right side, 3 the same name with the same name, the 3 trunks with the same name but left side. Here you see lumbar trunks and intestinal trunks, and of course the largest vessels like thoracic ducts and short right lymphatic ducts in the body. Very interesting details, very interesting information about lymphatic ducts drainage. Here visible that thoracic duct, the largest duct in the body, drainage mostly 3/4 of the body. That is largest lymphatic vessels in the organism, in the human organism. But the right lymphatic ducts is responsible for drainage from the right half of the head and neck. It drainages the lymph from the right upper extremity and the half of the thoracic chest, means the mediastinum and right pleuric, light pleuric cavity. So this is the difference between 2 lymphatic ducts. Here you see the thoracic ducts come into the left angle. This point where all ducts join veins we call angle, venous angle, and left venous angle between jugular internal left vein and left subclavian vein. Here we see opening the thoracic duct into the joining of the duct with the veins. But from the right side we see very short right lymphatic ducts, which is combined from subclavian, jugular and bronchomediastinal trunks. And we call this angle we call right venous angle. The different variation were described. The different variation of the thoracic duct were described in the anatomical literature, and there may be different position. More often it comes right between jugular vein and subclavian vein. Here the picture of right lymphatic ducts. We see this is one of the variant. Here when there is no right lymphatic ducts because all of trunks come into the veins directly. Maybe here only right, no, it's right jugular duct, so there is no, but it is the picture from the Zhdanov textbook, Zhdanov book about lymphatic system, and there are two variants of the right lymphatic ducts. First is concentrated when it present, but picture B, there is no right lymphatic ducts, and we call this variant loose form of the duct, of the trunks. Sorry. Here again the volume of drainaged areas in the body, 3/4 for the thoracic duct and 1/4 for the right lymphatic ducts. Development of the lymphatic vessels. Embryonic development start in 7-week embryo, and usually the lymph vessels begin as endothelial lined channels in the mesoderm called lymph sacs. This structure is lymph sacs, as you see. Usually we have 3 such sacs in the embryo body. Jugular, first one, primordial sac or sacs, and median lymph sacs located in different parts of the body. Then jugular lymph sacs are the first to form near the confluence of the internal jugular and subclavian veins. And here also you see the lactiferous cistern arising from the median lymphatic sac, which first grows from the primary vena cava and then departs from it. Smaller lymphatic vessels grow outward from the lymph cistern and follow the blood vessels that grow into the developing limbs. So, as you can guess, the development of the lymph is usually the same like in veins. So it is near in the characteristics there. Those were similar vessels in something. Lymph nodes, the group of small organs which are another component of the lymphatic system, which is another component of the lymphatic systems. And let's talk a little bit about this component. First, I'd like to demonstrate the Mascagni rule or Mascagni law. The Italian anatomist Paolo Mascagni established this rule in 1787. According to this rule, lymph on the way from here, lymph form lymph, and on the way from the place of formation in the interstitium to the confluence of venous angle, the lymph passes through the lymph nodes. It is necessary, obligatory, that at least one lymph node will be found on the way lymph from the tissue to the venous angle. Thus, lymph on its way to the venous system can pass through from 1 to 10 lymph nodes. it may be one nodes, it may be like here 1, 2, 3, and it may be even 10 lymph nodes on this way. But usually it is a rule. The more typical, it may be, it is necessary to be one, at least one nodes which interrupt the lymphatic vessels. An exception, of course, we have an exception, and they academic Zhdanov is has a monograph which is which describes the exception, but the exception just makes the rules as an expression, you know. Typical structure of lymph, which we say the flow lymph through the lymphatic nodes, and we distinguish efferent vessels which bring the lymph into the lymph node, and efferent vessels which bring lymph out. And comparison the volume of efferenting lymph, we call it VA, and volume of the lymph coming out from the lymph nodes, we call it VE. Usually VA is has more volume. It means that some of the lymph, part of the incoming lymph is absorbed into the veins, because every lymph node has arterial and veins which is responsible from the blood circulation in these small organs. Regarding the structure of the lymph node, we find the stroma. This is a connective tissue covering the lymph nodes and gives some of the septum or trabeculus inside of the body of the lymph nodes. This is the stroma, connective tissue. Cortex is the part of the lymph nodes located near to its surface. It has subcapsular sinus, lymph nodules. Here, this is spherical parts we call lymph nodules, and of course cortical sinuses where lymph located. Lymph coming into the node firstly come into these cortical sinuses, and the third part of the lymph node is the medulla. This is central tissue of the node, which consists of medullar sinus. We find different sinus here in the centrum of the node, and medullary cords. This is a special composition, usually fixed this part and build it like a stroma. In typical lymph node, making the histotopogram, we see cortical here around of the centrum of node, and medulla of this organ. This is also histological structure of lymph node, where lymphatic follicles are located close to the surface, close to the stroma. Here is the stroma or capsula of the node. And this is another picture in English, so you can take a look and see a real lymph node in the inguinal, in the human inguinal area. What is the function? What is the function of the lymph nodes? First of all, they produce lymph filtration and resorption of foreign particles and even on altered cells, for example, tumor cells. Phagocytosis, accumulation and decomposition of foreign particles or immune systems. This is the second role of the lymph nodes. Formation, antibodies, proteins, synthesis, neutralization of toxic substance. It is also possible to be carried out in the lymph nodes. Differentiation of lymphocytes. This is like a school or kindergarten for the new lymphocytes, and they get new features in the lymph nodes. And development of allergic reaction. It is interesting because it is the new information we get recently that the lymph nodes are responsible for allergic reaction. Metastasis, this is a sad function, but it may be done by the way of the lymphatic vessels coming through the lymphatic nodes, and this is a typical how cancer cells transport through the lymphatic vessels, but they stay mostly in the lymphatic nodules in different parts of the body, sometimes located very far from the origin place where we find primary cancer tumor. This is a special procedure in the medicine called lymphoscintigraphy. This is an invasive functional study of lymphatic system which help to introduce and to find the lymph nodes with the cancer cells inside. As you see here, this is the lymph nodes having tumor cells inside. Classification of lymph nodes may be classification of the lymph nodes may be done by shape, different shape, being ribbon-like, rounded, ovoid, and segmental, like here. Maybe such as strange forms of them. By the stage of lymph flow, it will be primary or first stage. These nodes located very near to the organs. Another nodes we call second stage nodes, that's located quite far from the organ, and nodes of the third stage, they usually located very far from the organ, but it may be the last nodes before the lymph come into the veins. By the area of our body, we distinguish lymph nodes of the head and neck, upper limb, chest, abdominal cavity, pelvic lymph nodes, and of course lower lymph nodes. Presence of lymph nodes and their location are characterized by inconstancy and variability. So this is sometimes difficult to say that in such place we will find the lymph nodes, but that is some of predictable location. They may have predictable location. And drainage area, visceral nodes, somatic nodes, and both group or mixed group of these nodes. Development, stage of development may be 3 stage. Accumulating lymphocytes, and this is some kind of primary form of lymph node. Then it gets capsule, and then it gets differentiation between medulla and cortex. That's all for today, my friend. Thank you for your attention. As usual, I am very glad you listened to me today, and I'd like to find all of you and see who was today in our lecture. And let me remind you that you have to pass the test after this lecture. You could find this test in the Moodle just after the hyperlink of this lecture, and I hope you will have no problems for this test. I am open now for your question. Please, if you have some question, please put it here, or another way, just put your question in the forum I also have organized in the Moodle today. Thank you very much. See you next lecture. It will be in the end of the September. That will be the last lecture for the second semester, and I hope to meet you there. Thank you. Thank you, and let me say goodbye.